As the coronavirus figures continue to rise, the World Health Organization has now highlighted what it calls concerning instances of the virus among people with no travel history to China. The WHO Director General has said that this could be just the tip of the iceberg, urging all countries to prepare for the possible arrival of the virus that has now killed over 900 people. In a tweet, he said, and I'm quoting, there have been some concerning instances of the infection spreading from people with no travel history to China. The detection of a small number of cases may indicate more widespread transmission in other countries. In short, we may only be seeing the tip of the iceberg. That statement now on your screens. He also said that while the spread of the virus outside China appeared to be slowing down, but could accelerate, warning that any breach in solidarity is a victory for the virus. Earlier, he also said that there was a pattern of stabilization in the number of cases.
In addition, there has been a stabilization in the number of cases reported from Hubei, and we're in a sort of a 4-day stable period where the disease or the number of reported cases hasn't advanced. And that's good news and may reflect the impact of the control measures that have been put in place.
Over 900 people have lost their lives, more than 40,000 confirmed cases of the infection. Outside China, there have been more than 350 confirmed cases reported in almost 30 parts of the world. Joining us now live on the broadcast is Mikey Kay from Paris. Mikey is an investigative journalist. Mikey, let me begin by asking you for your perspective on what the WHO has said at this point, the confirmed cases and the very fact that there is a confirmation of this infection being witnessed in people who have no travel history to China. How worrying is that assessment?
Well, I think what this finding from the WHO basically does is that it raises a very important question on the cascading level of effect that the virus seems to be having. So far we have seen from various countries around the world specific quarantine actions that have been taken in order to take people that have come in direct contact with the virus, namely people that have been inside Wuhan and China, flown back to their various countries. We've seen it in the UK recently with an aircraft that went back into Brize Norton. And those individuals are now under a 14-day or 21-day quarantine. And effectively what that means is that they're being kept in isolation to understand and assess whether they develop any symptoms of the virus. Now that is a procedure that is now taking place for those that are suspected of becoming or being in direct contact with the virus. Now, the virus is spread through spittle, serum, blood, or respiratory droplets. And the CDC, for example, in the Center for Diseases in the United States have basically given people in healthcare the advice that if they are coming into contact with someone within 2 meters or 6 feet for prolonged periods of time, then they themselves would be at danger of contacting the virus. So this is very much, and the advice is very much on a single level of direct contact with someone that has the virus. What the WHO now are saying is that there is now a second level and potentially a third level of cases where people may have come into contact with someone that has been to China or come back from China or in an area that's affected and is now affected having not been there themselves. So when people are now quarantined and isolated, the assessments now need to be on a much broader scale, which is not just the potential for direct contacts, but the potential of who they've been in contact with that may not have been to China, who they are, and tracking each individual lineage, if you like, to the virus. And I think this sort of broadens in a much bigger way the assessments that are now required for those people that are being targeted for quarantine.
Right, two things here. First, the aspect of whether China has been fudging the numbers, because we've seen several conflicting versions coming in on that front. And secondly, the concern that's already been raised by a Republican senator that this could be a biological weapon.
Yeah, I think there are two very interesting points you make there. Let's take the first one. Let's unpack the first one, which is being able to believe China, the credibility of what China is saying in terms of A, what the affected numbers are, what the statistics are, and B, what the measures are that they're taking in order to try and ameliorate this problem. I think we should not take what the statistics and what China is saying at face value. I think there needs to be an international community approach to Wuhan, and that basically means independent inspectors from the WHO, scientists, people that have a lot of expertise in virology. I think there needs to be almost like an aircraft board of inquiry, if you like. There needs to be a separate team that can independently verify what is going on. I think that's the first issue. The second issue as well is, and I've been investigating a few lines of inquiry on this, is to what extent does the Chinese military bioweapons program work inside Wuhan, and what have they been working on? Now, that's obviously really sensitive information that isn't going to be readily available, but there has to be a conversation, certainly, or the international community asking those questions, because we still don't know how this virus made itself, sort of started to spread in the first place. The fact that it's in Wuhan, for me, raises a red flag, because there's a level 4 facility in Wuhan. Wuhan's one of the very few places in China that actually has the capability to take on these very dangerous and very contagious viruses. And then also the fact that it's got a weapons program with the Chinese military that's also operated out there is a massive factor for me. You just have to look at the Department of Justice indictment last week, which basically has gone after the head of the viral lab, the bio lab in Harvard University, plus 2 Chinese citizens who worked in that lab. And one of them has been accused of trying to smuggle blood samples in her sock out of Boston Logan Airport into China. Where in China, we're not sure yet. But there's also another example of a Chinese virologist, a very prominent Chinese virologist who partook in one of the vaccines for Ebola. She was operating at a lab, NML, in Winnipeg, and she was escorted from that lab back in July 2019. Now, the Royal Canadian Military Police haven't said why she was. It was just under administrative issues. So there are certainly some things that I think definitely need more prodding, more investigation on. And the espionage, the bioweapons espionage, or the bioespionage threads that China have going on, not just in North America, but in Europe and around the world, I think there needs to be a lot more hard work in investigating just how expansive China is on that front.
Absolutely. We're going to leave it there for the moment, though, Mikey. Thanks very much for sharing those perspectives.